10 silent diseases that are decimating our elderly. In 2025, the alarming case of Pope Francis that we should all know about. Have you ever wondered what diseases are silently taking the lives of our elderly? Did you know that many of these conditions could be avoided with early diagnosis? What would happen if you could spot these signs before it was too late? Longevity has been a significant achievement of humanity in recent decades. However, with the increase in life expectancy, new challenges arise for the health of the elderly. Statistics show an alarming growth of certain diseases that mainly affect people over the age of 65. The recent case of Pope Francis, who faced severe respiratory complications, has brought to light a reality that many prefer to ignore. What if you could know right now the main threats to health in old age? These silent diseases are turning what would have been golden years into periods of suffering for millions of families around the world. Knowing these risks can be the difference between life and death for you or someone you love. Let's get started. 1. The silent killer. How cardiovascular disease steals years of life without warning. Cardiovascular diseases remain the leading cause of death among the elderly in 2025. We are talking about a set of conditions that affect the heart and blood vessels, including myocardial infarction and stroke. A recent study by the World Health Organization revealed that more than 16 million people die annually due to heart problems. The scariest thing is that approximately 70% of these deaths occur in people over the age of 65. High blood pressure, often called the silent killer, often has no symptoms until the damage is significant. Alarming data show that 45% of hypertensive elderly people do not know they have the condition. High cholesterol, another critical risk factor, can silently block arteries for decades. The heart of an elderly person beats approximately 3 billion times during their lifetime, but only a blockage can silence this rhythm forever. Atrial fibrillation, a common cardiac arrhythmia in the elderly, increases the risk of stroke by 5 times. Many patients confuse the first signs of a heart attack, such as pain in the left arm or shortness of breath, with normal age problems. The case of Pope Francis, who was hospitalized due to heart complications not fully disclosed, illustrates how these conditions affect even people with access to the best medical care. Regular blood pressure monitoring and preventive cardiological exams can literally save lives. But have you checked your blood pressure this month? Or are you waiting for your body to give signals that may come too late? 2. The invisible threat. When cancer lurks until it's too late. Cancer represents the second cause of death among the elderly, with particularly aggressive forms that develop in old age. Malignant tumors form when cells in the body begin to multiply in an uncontrolled manner, invading adjacent tissues. Advanced age is a significant risk factor, with 80% of diagnoses occurring in people over the age of 55. Among the elderly, the most fatal types are lung, colorectal, prostate, breast, and pancreatic cancers. Pancreatic cancer is particularly dangerous, with a survival rate of only 9% over 5 years. This is because its symptoms such as abdominal pain, weight loss, and fatigue are often attributed to the natural aging process. Each day of delay in cancer diagnosis can represent weeks less life for an elderly patient. Colorectal cancer, which could be easily detected through regular colonoscopies, still kills thousands of elderly people annually. Recent studies from the National Cancer Institute show that early detection can increase survival rates by up to 90%. Unfortunately, many elderly people are reluctant to undergo preventive exams out of fear or shame. Immunotherapy and targeted treatments have revolutionized cancer treatment, but they work best when the disease is diagnosed early. The cell mutations that lead to cancer accumulate throughout life, making the elderly particularly vulnerable. Long-term exposure to carcinogens such as tobacco, solar radiation, and certain chemicals significantly increases this risk. When was the last time you or your elderly family member had a complete checkup, including cancer screenings? 3. The missing air. Respiratory diseases that slowly suffocate our elderly. Chronic respiratory diseases rank third among the most common causes of death in the elderly. Chronic obstructive pulmonary disease, known as COPD, affects 1 in 6 elderly people over the age of 70. This progressive condition, caused mainly by smoking, gradually reduces respiratory capacity to critical levels. A study by the American Lung Association reveals that 75% of COPD diagnoses occur after the age of 60. The lungs of an elderly person with COPD can function at only 30% of their normal capacity, without them noticing gravity until advanced stages. The case of Pope Francis, who has faced serious respiratory complications recently, exemplifies how these conditions can deteriorate rapidly. Every cigarette smoked throughout life permanently damages the pulmonary alveoli, delicate structures that never fully regenerate. Chronic bronchitis, characterized by inflammation of the bronchi, causes a persistent cough that many elderly people consider normal for their age. Emphysema, another form of COPD, gradually destroys the pulmonary alveoli, reducing the area of oxygen exchange. Patients with advanced respiratory diseases often require oxygen supplementation to perform basic daily activities. Air pollution, especially in large urban centers, has been linked to an increase in deaths from respiratory problems in the elderly. Symptoms such as shortness of breath on exertion, wheezing, and chronic coughing should never be ignored in old age. Did you know that simple pulmonary function tests can detect breathing problems years before they become fatal? 4. When the mind goes out, the devastating reality of Alzheimer's and other dementias. Alzheimer's disease and other dementias have become increasingly prevalent, affecting more than 50 million people worldwide. Projections indicate that this number could triple up to 2050, making it a true silent epidemic. These neurodegenerative conditions progressively destroy brain cells, affecting memory, reasoning, and basic abilities. Approximately 1 in 3 elderly people over the age of 85 develop some form of dementia. Alzheimer's, responsible for 60 to 70% of cases, has no known cure so far. Early signs such as minor forgetfulness and mild disorientation are often confused with normal aging. Each neuron lost to Alzheimer's carries with it precious memories that can never be recovered. Recent studies from Harvard University suggest that brain changes begin up to 20 years before the first apparent symptoms. Early diagnosis through cognitive tests and advanced imaging tests can significantly slow the progression of the disease. Medications currently available only alleviate the symptoms without changing the progressive course of the condition. Modifiable risk factors include low physical activity, social isolation, untreated depression, and cardiovascular disease. Caregivers of Alzheimer's patients often develop serious health problems due to prolonged stress. The financial impact of Alzheimer's on families and health systems is devastating, with average costs exceeding $50,000 per patient per year. Have you ever observed subtle changes in the behavior or memory of an elderly person close to you? 5. The sweet poison. How diabetes becomes a death sentence in old age. Type 2. Diabetes reaches alarming proportions among the elderly, with prevalence rates exceeding 25% after the age of 65. This metabolic condition, characterized by high blood glucose levels, silently damages vital organs over the years. Many seniors live with undiagnosed diabetes for years, while the disease compromises their kidneys, eyes, nerves, and blood vessels. A study by the International Diabetes Federation reveals that 1/3 of elderly diabetics are unaware of their condition. Insulin resistance, the main mechanism of type 2 diabetes, naturally increases with aging. Diabetic complications such as neuropathy, retinopathy, and cardiovascular problems are responsible for millions of deaths annually. A simple daily prick to monitor glucose can add years of healthy life for a diabetic senior. Diabetic foot, a serious complication, results in more than 1 million amputations per year worldwide. Diabetic kidney disease is the leading cause of end-stage renal failure, accounting for 40% of new dialysis cases. Proper control of blood glucose, blood pressure, and cholesterol levels can reduce the risk of complications by up to 60%. A balanced diet and regular physical activity can not only prevent, but even reverse type 2 diabetes in its early stages. Simple tests such as glycated hemoglobin can detect diabetes years before serious complications develop. How many seniors in your family get regular screenings for diabetes? This simple measure could save lives. 6. The seasonal enemy: pneumonia and respiratory infections that strike when you least expect it. Pneumonia and other respiratory infections represent the 6th most common cause of death among the elderly. The age-weakened immune system makes the elderly particularly vulnerable to pathogens that would be easily fought off by younger people. A pneumonia that would be easily overcome by a young adult can be fatal for someone over 80. Statistics show that 50% of deaths from pneumonia occur in people over the age of 65. Pope Francis was recently hospitalized with a severe respiratory infection, demonstrating how these conditions can quickly affect even people with access to the best medical care. The symptoms of pneumonia in the elderly often present atypically, without the characteristic high fever and productive cough. A simple cold can open the door for opportunistic bacteria to turn an elderly person's fragile lungs into breeding ground for potentially fatal infections. Pneumococcal and influenza vaccination can reduce the risk of severe pneumonia by up to 80%. Even so, less than half of the elderly receive these vaccines annually, leaving them vulnerable to preventable complications. Bronchial aspiration, which is frequent in older adults with swallowing difficulties, is a common cause of pneumonia in this age group. Antibiotics that would work quickly in young people may be ineffective in older people due to the physiological changes of aging. Hospital admission for pneumonia in the elderly often triggers a cycle of complications such as delirium and functional loss. Healthcare-associated pneumonias, acquired in hospitals and nursing homes, are particularly dangerous due to antimicrobial resistance. Have you considered the importance of annual flu vaccination for the seniors in your family? 7. When filters fail, chronic kidney disease that silently intoxicates the body. Chronic kidney disease affects approximately 30% of older adults over the age of 70, often with no noticeable symptoms. This progressive condition gradually reduces the kidney's ability to filter waste and excess fluids from the blood. Kidney function naturally declines with age, but factors such as diabetes and hypertension dramatically accelerate this process. A study by the National Society of Nephrology showed that 80% of older adults with advanced kidney disease did not know they had the condition. Symptoms such as fatigue, bloating, and urinary changes are often attributed to the normal aging process. By the time symptoms become evident, the kidneys have usually lost more than 70% of their function. Each drop of blood passes through the kidneys about 60 times a day, but when these organs fail, deadly toxins begin to silently accumulate in the body. End-stage renal disease requires dialysis or transplantation, treatments that impose enormous physical and emotional challenges on the elderly. Only 1 in 3 elderly people with end-stage renal failure has adequate health conditions to support dialysis in the long term. Medications commonly used by older adults, such as non-steroidal anti-inflammatory drugs, can damage the kidneys when used chronically. Simple blood and urine tests can detect kidney problems years before they become irreversible. Proper control of blood pressure and diabetes can significantly slow the progression of chronic kidney disease. Did you know that simple dietary adjustments, such as controlling protein and sodium intake, can preserve kidney function for longer? 8. Beyond the tremor. The deadly secrets of Parkinson's that few know. Parkinson's disease affects more than 10 million people in the world, mainly elderly people over 60 years old. Far beyond the characteristic tremor, this neurodegenerative condition causes complications that can be fatal. The death of dopamine-producing neurons in the brain causes not only motor problems, but also severe autonomic dysfunctions. Aspiration pneumonia, resulting from swallowing difficulties, is the leading cause of death in patients with advanced Parkinson's. Frequent falls, caused by postural instability, and freezing of gait lead to fractures with a high mortality rate in the elderly. Severe depression, which affects up to 50% of Parkinson's patients, significantly increases the risk of suicide. Each dopaminergic neuron lost in Parkinson's disease progressively decreases the brain's ability to control the most basic movements we have always taken for granted. Sleep problems, such as REM sleep behavior disorder, can precede motor symptoms by up to 15 years. Autonomic dysfunctions, such as orthostatic hypotension, can cause sudden drops in blood pressure when standing up, resulting in fainting and trauma. Parkinson's-associated dementia affects up to 80% of patients in the advanced stages of the disease. Modern medications significantly improve symptoms, but do not alter the progressive course of the condition. Surgical procedures such as deep brain stimulation offer significant relief for select cases. Early identification of non-motor symptoms such as loss of smell, chronic constipation, and sleep disorders can lead to diagnosis before tremors appear. Do you know the early signs of Parkinson's that appear years before tremors? 9. The forgotten organ. Liver diseases that progress surreptitiously. Liver diseases have increased alarmingly among the elderly, with non-alcoholic fatty liver affecting up to 40% of people over the age of 60. The liver, silent in its suffering, rarely produces symptoms until the damage is extensive and often irreversible. Cirrhosis, the final stage of many liver diseases, compromises vital functions such as detoxification, protein production, and metabolism. Studies by the American Association for the Study of Liver Diseases reveal that cases of liver cancer have increased 115% in the last decade among the elderly. Chronic alcohol consumption, even in moderate amounts, can accelerate liver damage in aging organisms. Medications commonly used by the elderly, such as statins and pain relievers, can cause hepatotoxicity when used for long periods. The liver is the only organ capable of regenerating itself completely after damage, but this miraculous ability decreases dramatically with aging. Hepatitis C, often acquired decades earlier by transfusions or medical procedures with non-sterile materials, can remain silent for 30 to 40 years. New antiviral therapies can cure hepatitis C at rates greater than 95%, even in elderly patients. Hepatic encephalopathy, a neurological complication of advanced cirrhosis, causes mental confusion that is often mistaken for dementia. Periodic liver function tests can detect problems before they become irreversible. A balanced diet, weight control, and limiting alcohol consumption are essential to preserve liver health in old age. Have you talked to your doctor about the health of your liver during a routine checkup? 10. The fatal infection. How sepsis turns a simple infection into a case of life or death. Sepsis, the body's extreme response to an infection, kills more than 11 million people annually worldwide. This potentially fatal condition disproportionately affects the elderly, with mortality rates exceeding 40% after the age of 65. The aging immune system responds inappropriately to infections, allowing them to spread quickly through the bloodstream. A simple urinary tract infection in an elderly person can progress to sepsis in a matter of hours if not treated properly. The subtle signs of sepsis in older people, such as mental confusion and rapid breathing, are often attributed to other conditions. For every hour of delay in treatment with appropriate antibiotics, the survival rate decreases by approximately 8%. When sepsis sets in, every minute counts, turning a race against time into a literal battle between life and death for the elderly patient. Hypothermia, rather than fever, may be a sign of sepsis in the elderly, confusing less experienced professionals. Older adults who survive sepsis often face permanent cognitive and functional decline after recovery. Hospital-acquired infections are a common cause of sepsis in hospitalized older adults, especially those with compromised immune systems. Antimicrobial resistance has made the treatment of sepsis increasingly challenging, with limited therapeutic options for multi-drug resistant bacteria. Preventive measures such as vaccination, early treatment of infections, and proper catheter and wound care can significantly reduce the risk. Do you know how to recognize the warning signs of sepsis in your elderly family member? Knowledge can make the difference between life and death in an emergency. The health of our elderly should not be left to chance. The 10 diseases we discussed today pose real threats that can drastically shorten the lives of loved ones. However, there are reasons for hope and optimism. Most of these conditions can be prevented, controlled, or treated when identified early. The advancement of medical science has provided more accurate diagnoses and more effective treatments every year. Regular preventive exams, a healthy lifestyle, and knowledge of risk factors are our best weapons. Remember that taking care of your health doesn't start at age 60. It's a lifelong commitment. If you have seniors in your family, encourage them to have full checkups annually. Be mindful of the small signals your bodies may be emitting. The case of Pope Francis reminds us that even people with access to the best medical care face significant risks in old age. Share this knowledge with family and friends. Information saves lives. Together, we can transform old age into a period of fullness and dignity, not suffering. After all, aging with health and quality of life should be a right, not a privilege. The future of our seniors is in our hands, and the knowledge you have gained today is the first step in protecting them.